My name is Dean Petkanas. I'm the Chief Executive Officer at KannalLife Sciences. Well, it's important for us from a socioeconomic perspective, because the NFL is such a popular organization that the trickle-down approach of knowledge is really important when it comes from a big institution like that. So if they were able to separate themselves from the dogma of marijuana versus cannabidiol and embrace what we're doing in terms of the research and development of a therapeutic agent to treat CTE, that would translate into the potential for use if and when we produce a product or products become available either from a pharmaceutical or a nutraceutical perspective. Because then that gives confidence to families, put their kids on the playing field. And one of the things that has affected the NFL and has derided the prospect of putting more kids into a program, Pop Warner in high school, is now the high potential for long-term damage due to concussive injury. And I always use this to make a point: in absence of nothing, something. But there isn't a something. There's a diagnostic program, there's an acknowledgement now finally, but there isn't an active protocol in terms of what is the NFL saying to its players, aside from the push card pain management programs that are out there in post-combative environments, not pre. And so I think that when you regard cannabidiol as a neuroprotective, that becomes pre. And if they adopt an ideology that separates cannabidiol from the dogma of marijuana, it'll resolve some of the problems that I'm sure that they're having with team owners. I mean, look, if I was a team owner, I'm going to put on a pair of shoes and say I'm going to wear that hat. I don't want players taking products that are going to affect their ability not only to show up at practice, but to perform, because they're contractually obligated to perform at a high level. Something that takes away from their ability to perform would bring my judgment into question as to why I would sign an athlete. And this is not to take anything away from the Ricky Williams and the Josh Gordons of the world, but if THC is a chemical that retards ability to perform, whether to show up at practice or to be at the highest level of performance, that's where I think the dogmatic approach kicks in for the NFL, and I could appreciate that. But they have to, I think, come to a point scientifically and from a medical perspective that CBD is not marijuana. CBD is its own chemical product and chemical entity. I think they have to come to that conclusion. It's a dynamic conclusion. They'll come to it themselves. Whether they choose to work with us or not is completely up to them. We'd love to work with the NFL. I think we can bring shine a light of sobriety onto their efforts to deal with